Yes, hello. It's Dr. Anthony Rohangaibari, the medical team lead at St. Francis Healthcare Services in Jeru. And we are here to talk about the Hernia Project that we are starting very soon in October. And actually registration has already started. And we shall be offering subsidized prices for the surgeries and quite a number of other care that is needed for patients with hernias. And most of us have heard about hernias, but if I were to ask what hernias are, most of us really don't understand what the disease hernia is. Basically, hernias is when our internal organs, let's say the intestines, try to move through a point of weakness along our abdominal wall. And amongst these areas of weaknesses, we have along the midline, and then we have along the sides, for us what we call the inguinal areas. We also have around the diaphragm, the lining that separates the chest from the abdomen. Those are all hernias we can have. We also have some that come from the back that we call lumbar hernias. But the commonest ones, of course, are the umbilical hernias and the inguinal areas. And the inguinal hernias. The inguinal hernias are the hernias that protrude through the inguinal area, which is along the groin, and those are like the commonest ones. And amongst most of the patients, you'll find about 60% with those. And the commonest presentation, of course, is a swelling, a lump, mostly that comes on straining. Let's assume you're coughing, and then you see a lump protruding through your groin. That most likely is a hernia. Then the other is you'll see a lump along the umbilicus, where the umbilicus is. That is most likely a hernia. Of course, others, it's hard to diagnose them, like the diaphragmatic hernias. But we have other types like the lumbar hernias. We have other high-end hernias that are good for us to understand as medics, but for the patients, it's basically the inguinal, the umbilical, and the supraumbilical hernias. And these, of course, we have quite a number of misconceptions about hernias, and the commonest misconception is in what brings hernias and how they are treated. And in telling you what brings about these hernias, it's basically our walls becoming weak, and then these intestines tries to look for a point of weakness where it enters, where it goes through. And the point of weaknesses are mainly at the midline and the lumbar and the inguinal areas. And this is because, of course, when we are being formed in our mother's wombs, initially we are open like this, and then we come and then we form at the midline. And then, of course, for the men, the testicles initially are intra-abdominal, they are in the abdomen, but as they are being formed, they come down. So in that process, they leave a point of weakness, and that point of weakness, with the straining and the hard work, is what becomes weakened, and then the intestines try to go through that point. The other risk factors, of course, are people with a chronic cough. Yeah, people who have like TB, who have COPD, who have been coughing for a very long time. Whenever you cough, you strain, the pressure in the abdomen increases, and then these intestines try to pass through this point of weakness. The other risk factor is pregnancy. Pregnancy, first of all, weakens the hormones that are produced in pregnancy, and they make the muscles a little bit relaxed. But then the other thing is that when you're pregnant, the abdominal wall, which is a little bit hard when you're not pregnant, is stretched and becomes a little bit weak. And actually we receive many mothers complaining after delivery that I have a mass protruding from my umbilicus. I have a mass protruding above my umbilicus, and this started after delivery. So those are all risk factors. Then, of course, there are other risk factors like smoking. Smoking, the nicotine weakens our muscles. And then there's heavy lifting. Then there is, now for heavy lifting, I normally give an example of people who want to over gym. They do beyond what their bodies can handle. So the abdominal pressure increases, and then the intestines try to look for where to pass. And then the other risk factor is old age. Of course, as you grow old, the muscles weaken. And then the other risk factor, of course, is there are children who are born with hernias. Of course, if we are to classify hernias, you would say there are these that are acquired, and then there are these that are born with those hernias. So there are babies who are naturally born with that defect, and then the intestines try to pass through. Those ones are congenital, yes, the right word is congenital. And then there are those that are acquired now, like for the heavy lifters, the pregnancy, and those other risk factors, most of those are acquired. So the other misconception we normally have is with the treatment, most people who get hernias tend to think that there is a solution apart from surgery. I normally give them an example of a torn cloth. Let's assume this coat is torn, and then you want it fixed back. You have to stitch where the hole is. So the same applies to hernia. Because there is a point of weakness, there is a defect in the abdominal wall. So we have to close off this defect. So the only medicine, the only cure to these hernias is surgery. There are no shortcuts. No amount of jerry cans and herbs can take away hernias. No amount of these other medicines can take away the hernia. No amount of prayers can take away the hernia. No amount of witchcraft can take away the hernia. The only solution to this hernia, like I said, is surgery. And we as St. Francis are comfortably offering subsidized surgeries for patients who have hernias. The other symptom that I forgot to talk about is pain, and when the hernia gets complicated, that I'll briefly talk also about it. But the other symptom that you can get is pain, mainly in the morning. This is because the defect, we normally call it a ring. In the morning, it normally constricts, and when it constricts, it narrows. When it narrows, the muscles are a little bit strained, and you'll end up with the pain. But there are also other symptoms that come because of complication. Let's assume the intestine enters in the defect, and then it loses blood supply, or it gets obstructed. They will present with vomiting, you'll not be able to pass stool, all signs of intestinal obstruction, like vomiting, you'll not be able to pass flatus, you'll not be able to pass stool, and then severe abdominal pain, and of course the non-specific symptoms like the headaches. But the commonest one is a lump, and then pain that comes mainly when it's cold. And the lump, like we said, comes mainly on straining, let's say coughing or heavy lifting. That's when the lump becomes more prominent. The other thing that I forgot to talk about is what happens in case we don't get treatment for this hernia. Knowing that we've understood that what a hernia is, when we don't treat this hernia, there are complications that come out of hernia not being treated surgically. For one of them is intestinal obstruction. The intestine enters, and then it's trapped in there. Food can't move, flatus can't move, gas can't move. So one of the complications is intestinal obstruction, and that is life-threatening. Because just imagine gut is not moving. You're not able to feed, you're not able to pass flatus and stool. That becomes catastrophic. So that is one of the complications. The other complication, even you don't treat, is that this gut can get trapped in the defect, and then blood supply is cut off and it begins dying off. So once it dies off, it is easy for it to rupture. And once it ruptures, everything spills into the abdomen. we end up with a condition we call peritonitis. That is also life-threatening. Of course, not forgetting other complications like electrolyte imbalances in case this happens, and because of the vomiting as well. But the commonest complications are those three that we've talked about. With the knowledge of the complications, you know what can happen. Gut can get trapped in there and get intestinal obstruction. Gut can rupture, and then we also end up with the peritonitis. So it is very, very important for us to seek medical attention before we come to these complications, because it is very avoidable not to reach where the complications are life-threatening. So it's important to seek surgical or medical treatment before we get to these complications. Now, like for example, in case gut is trapped in there and you're presenting with signs of intestinal obstruction, remember you're not able to feed, you're vomiting everything, the body is not in its normal state, chances are high that we shall lose you. So that is why it is very, very important before this gut gets trapped in there, you seek medical attention as soon as possible. In other words, in case you see a lump, or in case they tell you you have a hernia, it is important you reach out to any hospital, preferably St. Francis, that is able to offer you subsidized surgical care for these hernias. Otherwise, when you wait and we get into complications, it's big trouble. It's big trouble. The surgery, first of all, in case we are to have after complication, is quite more expensive, and the complications also are a little bit more than when we work on this hernia before it becomes complicated. Okay, so we decided as St. Francis to give back to our community, and we have this hernia project that is here to benefit the Ugandans. Yes. And so in case you think you have a hernia, what you do, you come to St. Francis in Njeru, just before you cross the bridge, the Jinja Bridge, you come to the facility, we screen you, and then we confirm whether you have a hernia, and then we schedule for surgery at a subsidized fee. Or the other option is you contact the number shared on the screen below, and then we see how to help you. Yes, this project, of course, is being supported by our friends of the Rotary Club of Jinja, Rotary Club of Sidmouth, and the Hernia International organization, and of course not forgetting St. Francis Healthcare Services. And we really want to thank them for the support, because they have made sure everything is set to have this project become a successful. They have given us quite a number, because one of the things they have made sure we have is the mesh that we use in hernia repair that has proved to be 100%, almost 100% effective in preventing recurrences, unlike the rudimentary methods you've been using. So in this project, you'll get a subsidized hernia repair with a mesh. So chances of recurrence are very minimal. So we look forward to working on you and to see this project become a success. Yeah, this project, of course, was thought about carefully, and the main reason was because quite a number of our clients have hernias, untreated hernias, and they present with complications. So we thought it wise that if we subsidized these surgeries and we have them done at a subsidized cost, this could help these people who are not able to afford the high bills of the surgery. And we feel this will create a very big impact, because this will help these people who have the hernias to resume their work and fend for their families, and also live a normal life. We feel this is going to be very impactful, and it's going to help our community and restore as well hope to these people who had lost hope. Yes, in case you have hernias, or you know someone who has a hernia and is not really able to afford a surgery, and once it's done, worked on, we request this patient reaches us on the numbers shared on the screen below, and then those that are able to come to the facility, that is St. Francis Healthcare Services in Njeru, just before you cross the bridge, the Nile Bridge, you reach out to us, we screen you, and then we see how to help you.